What is anatomical movement? Anatomical movements can be defined as the act or instance of moving the bodily structures or as the change of position in one or more of the joints of the body. Anatomical movement. Flexion. Extension. Abduction. Adduction. In certain joints there is so much versatility of movement that the individual parts can be moved about several different axes. Such multi-axial joints best exemplified by the shoulder joints. Internal rotation, also known as medial rotation. External rotation, also known as lateral rotation. Internal rotation and external rotation at the shoulder joint can be demonstrated not only with the arm in the neutral position. Abduction. External position. Internal position. A sequential combination of all these movements in the shoulder joint is referred to as circumduction. Pronation. Supination. Flexion of wrist. Extension of wrist. Lateral or radial deviation or abduction. Only a deviation or adduction. Fingers are capable of flexion, which is a forward bending of the fingers. Straightening of the fingers, which is extension. Abduction of the fingers. Adduction of the fingers. Flexion. Extension. Abduction of thumb. Adduction of thumb. And also a rotary movement whereby the pulp of the thumb can be made to face the power-ups of the other fingers. Lower body movements. The movement at the hip are flexion reflected movement of the thigh. Flexion of the hip. Extension reflected in the backward of the thigh. Extension of hip. Abduction when the thigh is moved outward away from the median axis of the body. Abduction of hip. Adduction of hip. The hip joints is also capable of internal rotation and extension rotation. Extension rotation. And either of these movements at the hip joint can be accomplished either with limb straight or with the knee flexed. A sequential combination all of these movements at the hip joint constitutes circumduction of the hip. Flexion of the knee and extension of the knee. Extension of the knee joint is manifest as forward movement of the leg, and this apparent contradiction is explained by the rotation of the lower limb that happens during embryological development. Flexor surface of leg. Front flexor of leg. The ankle joint, which is a uniaxial or hinge joint. The movements possible at the ankle joint are extension of ankle, flexion of ankle. Various small joints in the foot allow specialized movement of the foot and inward rotation of foot whereby the medial border of the foot is elevated relative to the lateral border is referred to as inversion. In the opposite movement wherein the lateral border of the foot is elevated relative to the medial border of the foot constitutes aversion. Aversion. And finally the toes are capable of flexion and extension, and the toes are capable of abduction and adduction however. In the foot, abduction and adduction of the toes is related to the long metatarsal of the second toes.